Well, the Centers for Disease Control is now formally recommending that adults age 65 or older receive another COVID vaccine this spring. Now, they reference data that has shown a reduced rate of hospitalizations and even reduced deaths among senior citizens who received those booster vaccines. And our medical expert, Dr. David Winter from Baylor Scott and White Health, joins us now to discuss it all. Now, Dr. Winter, what are your thoughts on the additional COVID vaccines?
Well, Tashara, the evidence is pretty compelling. 54% less risk of being hospitalized with severe COVID if you've had a vaccine as opposed to the folks that ignore the vaccines. There's still lots of COVID out there. Now, unfortunately, most COVID cases that I see are very, very mild, but you still have 36,000 new cases every week going to the hospital. Most of those are the older folks. That's the recommendation for older folks to get a vaccine twice a year.
So what about younger folks? Would they benefit from those additional boosters as well?
Anyone who's got some immune problems, yes. If you have some immune disease, if you're taking antisuppressive or immunosuppressive drugs, you should consider that. For healthy folks under 65, current recommendations, though, are just a vaccine once a year for COVID.
Okay, flu vaccines, those are recommended only once per year. Why the need for twice yearly when it comes to COVID vaccines?
Well, that's a good question. Flu's been around a long time. It continues to mutate every year, but only comes out in a surge in the cooler months, in the winter. Now, we've had COVID around here for almost 4 years now, a little bit over 4 years, and we found that it has continued mutations, but also surges twice a year. Thus, a recommendation for a vaccine for vulnerable people twice a year also.
Okay, for those who received a COVID vaccine later in the fall, how long should they wait to receive another booster?
Yes, if you had a vaccine last month or the month before, you should wait 4 to 6 months, the CDC recommends. Now, all these recommendations, Tashara, let me just point out, this vaccine's been around a little over 4 years. I'm sorry, not the vaccine, but the virus, a little over 4 years. We're learning a lot about this. It keeps changing, and as it keeps changing, the advice and recommendations also are likely to change, so stay tuned.
Okay, and you know we'll do that. Dr. David Winter, thank you so much. Appreciate you joining us.
Thank you. Good to be with you.